Azithromycin is commonly used to treat a wide range of bacterial infections. It belongs to a group of antibiotics called macrolides, and it works by preventing the growth of bacteria in the body. However, it's important to note that this medication will not be effective against viral infections, like the common cold or the flu. It's crucial to use azithromycin only as prescribed, as unnecessary use or misuse can lead to decreased effectiveness. As for the daily dosage and optimal timing, it's best to follow the instructions provided by your healthcare provider. Before starting azithromycin, be sure to read the patient information leaflet provided by your pharmacist. Take this medication by mouth as directed by your doctor, usually once daily with or without food. If your stomach gets upset, you can take it with food. The dosage will depend on your medical condition and how you respond to the treatment. For children, the dose is based on their weight. Make sure to shake the suspension well before using and measure the dose carefully using a special measuring device/spoon. If your child vomits the one-day treatment dose within 30 minutes, call your doctor to see if you need to repeat the dose. For the best effect, take this antibiotic at evenly spaced times, and try to take it at the same times every day to help you remember. It's important to continue taking the medication until the full prescribed amount is finished, even if your symptoms disappear after a few days. Stopping the medication too early may result in the infection coming back. If you take an antacid that contains aluminum or magnesium, be sure to wait at least 2 hours before or after taking azithromycin, as these can decrease the absorption of the medication. Remember to tell your doctor if your condition lasts or gets worse. Some common side effects of azithromycin include stomach upset, diarrhea/loose stools, nausea, vomiting, or abdominal pain. However, many people using this medication do not have serious side effects. It's important to tell your doctor if you experience any serious side effects, such as hearing changes, eye problems, difficulty speaking/swallowing, muscle weakness, signs of liver problems, fast/irregular heartbeat, severe dizziness, or fainting. In rare cases, this medication may cause a severe intestinal condition due to a bacteria called C. difficile. If you develop symptoms such as diarrhea that doesn't stop, abdominal or stomach pain/cramping, or blood/mucus in your stool, it's important to contact your doctor right away. Prolonged or repeated use of azithromycin may result in oral thrush or a new yeast infection. If you notice white patches in your mouth, a change in vaginal discharge, or other new symptoms, be sure to contact your doctor. While a very serious allergic reaction to this drug is rare, it's important to seek medical help right away if you notice any symptoms of a serious allergic reaction, such as fever, new or worsening lymph node swelling, rash, itching/swelling, severe dizziness, or trouble breathing. It's important to note that an allergic reaction to this medication may return even if you stop the drug. If you have an allergic reaction, continue to watch for any of the above symptoms for several days after your last dose. If you experience any side effects not listed above, it's important to contact your doctor or pharmacist for further guidance. Remember that it's important to seek medical advice for any side effects you may be experiencing. Before taking azithromycin, make sure to inform your doctor about any allergies you may have to antibiotics, as this medication may contain inactive ingredients that can cause allergic reactions. It's important to also disclose your medical history, especially if you have liver or kidney disease, or a certain muscle disease. Azithromycin can affect the rhythm of your heart, causing a condition called QT prolongation, which can lead to serious symptoms that require immediate medical attention. The risk of QT prolongation may increase if you have certain medical conditions or if you are taking other drugs that can cause QT prolongation. It's important to talk to your doctor about all the medications you are taking and any underlying medical conditions you may have. Low levels of potassium or magnesium in the blood can also increase the risk of QT prolongation, especially if you are using certain drugs or if you have conditions such as severe sweating, diarrhea, or vomiting. It's important to discuss with your doctor about using azithromycin safely. Azithromycin may also interfere with the effectiveness of live bacterial vaccines, such as the typhoid vaccine. It's important to inform your healthcare professional if you are using azithromycin before receiving any immunizations or vaccinations. Older adults may be more sensitive to the side effects of this drug, especially QT prolongation. And babies, especially those younger than 6 weeks, may be at higher risk for a serious stomach problem. It's crucial to contact your child's doctor right away if your child vomits or becomes irritable with feeding. If you are pregnant, the use of azithromycin should only be considered when clearly needed, so it's important to discuss the risks and benefits with your doctor. And if you are breastfeeding, it's important to consult your doctor before using this medication. It's important to be aware that azithromycin may interact with other medications and affect how they work or increase the risk of serious side effects. Make sure to keep a list of all the products you use and share it with your doctor and pharmacist. Do not start, stop, or change the dosage of any medicines without your doctor's approval. Additionally, there are many other drugs that may affect the heart rhythm, such as amiodarone, chloroquine, disopyramide, and others. It's important to discuss all of your medications with your doctor to ensure they are safe to take together. If you or someone else has taken too much azithromycin and is experiencing severe symptoms like fainting or difficulty breathing, it's important to seek immediate medical help. In the U.S., you can call your local poison control center at 1-800-222-1222, and in Canada, you can call a provincial poison control center. It's important not to share azithromycin with others. This medication has been prescribed specifically for your current condition, so it shouldn't be used for another infection unless directed by your doctor. If you happen to forget a dose of azithromycin, take it as soon as you remember. However, if it's close to the time for your next dose, just skip the missed dose and take the next one at your regular time. It's important not to take a double dose to make up for the missed one. When it comes to storing azithromycin, it's important to keep it at room temperature, away from light and moisture. Avoid storing it in the bathroom and make sure to discard any remaining medication after 10 days. Always keep medications out of reach of children and pets. When it comes to disposing of azithromycin, never flush it down the toilet or pour it into a drain unless specifically instructed to do so. Properly discard any expired or unused medication by consulting your pharmacist or local waste disposal company. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.